Hey guys, it's Preston Brown, physical therapist with Prestige Therapy and Wellness. I want to talk today about our knee joint or the knee. And this is something that I feel is important as a physical therapist because understanding the structures that are within the knee joint is very important, and things that surround the knee joint, especially when you're dealing with issues. Maybe it's discomfort, pain, maybe it's stiffness or tightness. Now, let's think about it this way. When you are thinking about our joint at the knee, there's going to be the bone on top of the knee joint, and then there's going to be a bone on the bottom of the knee joint. So they come together. The top bone, our femur, and then the bottom bone, the tibia, meet. And in between my knuckles here would be the joint, the knee joint. So it bends, it straightens out, and in between the bones there are going to be two cushions in between there, and the cushions provide shock absorbance. So when you're walking, running, bending, it provides some cushion in between there. And also on the end of each of the bone, there's going to be this nice smooth surface, and on both sides of the bone or both ends of the bone where they meet, it should be very smooth, and when they move it should glide really smoothly. Now what happens in later life, especially if you had any previous injury, if you have done a lot of work where you're maybe putting a lot more pressure on your knee joint or that area, then it could lead to that smooth surface becoming a little more less, and the cushion squishing down, so the bones are meeting up. And when the bones are meeting up and the smooth surface is gone, it's kind of like concrete on concrete, not ice on ice. So ice on ice would be very smooth and it would glide really nicely, whereas concrete on concrete would be a lot of friction, and it would be also something that wouldn't bend and move as easily. Now, the factor or that smooth surface we call cartilage, that breaks down, and sometimes that breaking down of the cartilage can really put a lot of irritation on the end of the bone. And especially when you're walking and bending and moving the bone and it's rubbing, that's where the irritation can happen. And then what happens with irritation, our body says, that's pain. So let's stop doing that. Now, what is it that maybe cause pain or discomfort for you? Maybe commonly what I hear with individuals I help is walking up and down stairs, kneeling down, getting up from a low surface, doing too much standing or sitting in one position. Maybe it's sleeping at nighttime can cause pain or discomfort in the knee or the knee joint. Now, if you think about it, when we have a joint like the knee, you have a lot of range of motion. So what we want to do to help decrease that pain or to ease that pain, especially if it's from arthritis or from the bone on bone, sometimes it's considered or called bone on bone pain. We want to first off do things that don't provoke the pain. We want to avoid those things. If that particular thing is causing discomfort or a lot of excruciating pain, stop that thing, and you want to maybe discuss this with your healthcare provider. Now, the thing we can do for that pain, or things we can do for that pain, would be things like swimming, because you're offloading the joint, but also you're still getting a lot of motion in the knee. Exercises that are going to be less impact, meaning impact is, the bones hitting. Things like running can cause a lot of impact. Even brisk walking can cause a lot of impact, especially if you're going up and down grade or if you're on terrain. That can cause a lot of impact. However, walking can be very beneficial if it's done in the proper manner. Also, exercises that promote bending of the knee, but in a pain-free or less pain position, because we don't want to provoke pain. We want to do things that are going to ease the pain, but you have to understand pain is part sometimes of the way the body is responding to certain things too. So we have to understand the difference in what types of pain there are. The other thing you can do, so if you're sleeping, maybe trying not to sleep on that particular, if it's your right knee, try not to lay or put a lot of pressure on the front of your knee. If you lay on your stomach, try to avoid that. Maybe not putting all your body weight on that leg. Maybe laying sideways on the other side of or left side, putting a pillow between the knees, trying to ease the pain. That may help. There are other things too, like sitting with your legs crossed. If you are someone who sits with your legs crossed, that's a habit you might want to try to reduce, because that puts a lot of pressure on the back of the knee. There are arteries back there where your blood is being pumped from your heart down to your feet. You have nerves running down the back of your leg, so that pressure when you cross the legs over can compress some of those things. You also have a fluid-filled sac behind your knee that helps muscles glide and move in the back of the knee. So by putting pressure there, that can irritate that fluid-filled sac, and they call that bursitis, which can increase pain. Itis, inflammation, pain. There you go. So the other thing we would want to consider is thinking about muscles around the knee joint that maybe you could strengthen or work on. You have muscles in the front of your thigh or the front of the knee joint. Then you have muscles behind on the backside of our thigh or the backside of our leg, which we want to think about strengthening or maybe even stretching to help decrease some of that bone-on-bone pressure. Also strengthening to relieve some of that pressure between the joints and to ease the activity. Now, we want to think about it in this regard. When you're having issues, whether it is something that's been going on for years, whether it's something that just started, you always want to think about is the severity and how much this pain impacts what you're doing day to day. And we can address things like this, especially as a physical therapist, being able to provide some education, also being able to provide some things that may help or maybe to avoid, kind of like what we talked about today, but being a little more insightful to your current situation and talking about what it is that's impacting your life today. So I just wanted to share this video with you. I hope you found it to be beneficial. And as always, thanks for watching. Hope you have a great rest of your day. Bye-bye now.